Peter C2 back again with part 3 of 4, and we're going to start focusing on the regulations pertaining to the use of the HDR remote afterloader that you're going to add to the skill set of 10 CFR 35. So this is the .600 section. One important thing to discuss is the fact that Missouri is an NRC state. In those agreement states that are highlighted in the light gray and are surrounding Missouri and a number of other NRC states, the rules may vary. The good news is that the rules for those agreement states have to be at least as stringent as the NRC guidelines that I'm going to be discussing today, but there may be additional rules, postings, safety efforts that are not on the NRC side of things. So this information is unfortunately not transferable to all the states. The section we'll be highlighting is in subpart H, talking about 35.600, the use of a sealed source in a remote afterloader unit, teletherapy unit, or gamma stereotactic radiosurgery unit. So the point of this presentation is to remove everything that's not directly related to 600 use for the afterloader. So those sections that are only teletherapy unit or gamma stereotactic radiosurgery unit are omitted and left to the reader to discover on their own. So we'll only be talking about the sections pertaining to the afterloader. The first statute is 35.600, and it says that if there is a sealed source in a photon-emitting remote afterloader unit, that there has to be an approved sealed source or device registry. So there is the one exemption for IDE, investigational devices. That's not going to be applied to the vast majority of clinical settings. So sealed source registries prior to 2002 have different guidelines than after 2002. We're mostly concerned with guidelines that are generated for machines post 2002. 35.604, the survey of patients and human research subjects treated with the remote afterloader unit. So this statute is possibly or partly due to a lost iridium-192 source resulting in the death of 8 persons in Morocco at an industrial facility. But the point is that we need to know that before we release the patient or a human research subject from a licensee control, that the survey has been completed to make sure that the source has not gone with. So very, very important. High dose rate sources have the potential to be fatal. 35.605, installation, maintenance, adjustment, repair. What it says is that only a person specifically licensed by the Commission or the agreement state shall install, maintain, adjust, or repair a remote afterloader unit. So for the purposes of this presentation, we'll be talking about the Varian service engineer, Stephen LaBarbera, who will be the primary contact for the Gamma Med installation. The Varian emergency hotline is 864-1672, and the technical support line is 888-VARIAN-5. These numbers will be posted at the afterloader console. 605 says that you have to have only an approved person. Our approved person is Stephen LaBarbera. 35.610, safety and instructions. Safety procedures and instructions for remote afterloader units, teletherapy units, and gamma stereotactic room units. So the unit must be secure. In other words, that when there's no one in the treatment room or the room is unattended, there must be some way to assure the safety of the source and the unit itself. And only authorized users, radiation safety officers, or authorized medical physicists shall be are required to be present, but they should be present during the treatment of the source, including any necessary adjustments during commissioning or something like that sort of things. If you have a dual operation room, then you have to make sure that the dual operation is prevented for the other device. And this is in the case of LINAC vaults that have been converted to actually to also use the afterloader. Instructions for responding to equipment failures and a process for restricting access in the posting of the treatment area to minimize the risk of inadvertent exposure are all things that are in 610. So these are safety procedures and instructions are highlighted in 610. The names and the telephone numbers under number 2 there of the authorized medical physicist, radiation safety officer should be posted at the console, and that's an important addition to that. The records from everything that occur need to have the 35.2310 record of safety instruction and 2610 record of safety procedures. So safety instruction must be kept on file for 3 years, and safety procedures shall be kept until the licensee no longer possesses the remote afterloader. (35.615) Safety precautions for remote afterloader units. So, a licensee shall equip each entrance of the treatment room with an electrical interlock system that will prevent the operator from initiating the treatment unless the treatment room entrance is closed. Cause the source to be shielded when an entrance door is opened and prevent the source from being exposed during interlock interruption. So all this section of B123 is talking about what happens specifically to the source in the case of an interruption. Letter C states that we have appropriate radiation monitors and radiation levels have returned to ambient levels. Letter D describes the necessity of having viewing and intercom systems available. Letter E describes what needs to happen in the case of requiring expeditious removal of a decoupled or jammed source. F1 refers to medium dose rate brachytherapy. And section 3 is stuck in there for gamma stereotactic radiosurgery units. The requirement is the same for the afterloader there. So of the most importance of the statutes is that for a successful treatment and the treatment that follows the NRC's guidelines, the authorized medical physicist and the authorized user must be at the console during the entirety of the treatment. There is some interpretation of what at the console means, but for the most part, they need to be present. They need to be not elsewhere in the department or off the premises during the course of a treatment. And letter G describes the applicable emergency response equipment available near each treatment room to respond to a source remaining in the unshielded position or lodged within the patient following the completion of a treatment. So this goes back to the emergency safe. 10 CFR 35.630 dosimetry equipment. For all the systems that we're going to use to calibrate the source, in most cases just referring back to a calibration certificate and verifying the accuracy of it, the source calibration system must have been performed within the previous 2 years. And it must have been performed with a source traceable to the NIST standards by some published protocol accepted by a nationally recognized body. The licensee must have a dosimetry system available for the use of the spot check of output measurements. The system may be compared to a different system that's calibrated according to the previous guidelines, but the calibration must have been, the comparison must have been performed in the previous year. So for the purposes of maintaining the calibration consistency, it's a good idea to just go with the calibrated system every 24 months. There are options to get around that highlighted in 630. For the records, the records of these calibrations are required to be kept on site via 35.2630. For the duration of the license. So for different documents, there is a different lifetime for all calibration records for the dosimetry equipment. The calibration and comparisons must be kept for the duration of the license. Thanks for this stop. This is the end of part 3. Here are some questions to feed your thinking.